Good afternoon, and welcome to our Tuesday afternoon press conference at Delaware's response to COVID-19. I'm joined once again by the director of the Delaware Emergency Management Agency, AJ Shaw, who's taking on the role as the point person for our enhanced testing program, and we're really excited about that. He's going to talk more about that later. And of course, the director of the Division of Public Health, Dr. Rattay, who and her team are just doing an incredible job with keeping a lot of balls in the air. A lot going on over the last several weeks, the last week in particular, as we've tried to address the outbreak of coronavirus in the lower part of our state, with an incredible number of testing that's being done both at the poultry plants as well as in the communities. Some 8,000 tests or more, and results coming back as we speak, and we'll have a better idea of where we stand there. It's just, I think, just hearing very positive messages from the Secretary of Agriculture about the reaction to the workers in the plants, just feeling more comfortable, more confident, both to come to work as well as to understand the spread of the virus in that community. And that's a good thing in and of itself, and we're getting a better handle on the spread, and I think doing a pretty good job at outreach and communicating with folks in the communities, in the homes, to try to protect them and their families and spread further in the community. While doing that and continuing to engage our partners at the hospitals, and again, hats off to all the hospital workers and the hospitals themselves for being really the foundation of our health system here in Delaware, and particularly in the testing system that we've had over the last 2 months. We're going to be moving into a new phase, as I said, with AJ and triple or quadrupling the number of tests we're doing on a day-to-day basis. And that'll be really an important part of protecting the public going forward as we allow more people to circulate. You know, the concepts about how you contain the virus, how do you protect one another and stay safe, are pretty simple at some level. What we've used to date as states across the nation and the country and countries around the world is initially the blunt instrument of stay-at-home orders, quarantining, isolating folks as a group at home, closing businesses for periods of time. And now, as we gradually reopen and allow people to circulate a little bit more, while still reinforcing the message of being careful and keeping socially distant, our focus on containing the virus will be on intensive testing, isolating those who test positive, tracking down folks they've come in contact with, testing them and isolating them as well. And so it's really isolating the individuals who are COVID-19 positive and their contacts, as opposed to isolating the whole community, and some combination of the two. Dr. Birx, who comments frequently on our White House task force calls, has a really simple concept, and that is, if we would do just 50% less of the in-public activity that we would normally do, that would go a long way to protecting one another and keeping the spread. And the overall objective to all of our focus on allowing folks to, businesses that are closed, to come back online, whether it's restaurants, retail establishments, or the like, is to really prevent large gatherings and to emphasize continued emphasis on social distancing. And so as we look at the data, the number of positive cases continues to rise. We're up to 6,700 now. Sadly, again, the total death toll at 237. Still, the vast majority of those fatalities are in our senior population demographic, those with pre-existing health conditions. 2,800 total recoveries, and as well as a number in our state facilities, Delaware Psychiatric Center and Department of Corrections, and a number that we continue to be pleased with, and that's our current hospitalization number, which continues to trend down, which is both a good sign for the health of the community. It's a good sign for, since our number of positive cases is increasing, the severity of those cases, that they don't require hospitalization, and ultimately our ability to protect those who are most vulnerable with available hospital capacity. So 2,400 positive cases now in Newcastle County. That number is flattening down, as is the 1,000 cases in Kent County. But again, here in Sussex County, as we continue to intensely test in the poultry plants, all those workers, and in the communities, you're seeing, as we expected, the number of positive cases increasing. At the same time, though, the hospitalization rate in Sussex County has gone down. It's been something that we've been pleased with, but curious to think about, and we are thinking about what that does mean. The demographics of the cases are pretty consistent throughout. Not many infections among younger people, teenagers and below. And here's our data dashboard that we've been looking at, and then some other indicators. And what we're looking for is all those lines to be headed down from left to right. And you can see we have, and I've mentioned this a number of times, some of the data issues that we have, and you can see that there in the percent of persons who tested positive. It's our view that this is just an aberration of the data collection process and the way it's put into our system. We know that we've tested a lot more people. And so my guess there is that the denominator doesn't reflect all of those tests, and the numerator being a higher number because we know we have the cases and we've seen them. That graph and the one below it on the far left should be more consistent. That's the number of positive cases, and so trending down as well. And again, that's a good example of why we've chosen a data dashboard, just because of some of the processing challenges in our testing program and in the way that data is put into our public health system. We expect that, because even if you take the last day, the rate, that top rate on percent positive is close to 30% or maybe above. I can't see the number from here. The top number's in the mid 30%. And we know just in the last day, the percentage was around 10%. 12%. And that is a 5-day moving average, but we're seeing more like a 12 to 15%, certainly under 20% range, which would be lower than that. So still in the right direction. Again, more of our dashboard. Here are the PPE requirements that we need in moving towards phase 1. This is a red, yellow, green type of a chart here, and everything except in the fluid-resistant gowns is in the green category. That does change day to day, week to week, because it is a 2-week supply, measure a 2-week supply of these PPE. So our overall objective, as we've been saying from the beginning, is you can't have a healthy community without a healthy economy, and vice versa. You can't have a healthy economy without a healthy community. And in this case, the healthy community has to come first and enable us to reopen the various economic and business sectors. But you can't, it's not one without the other. You have to have both. It's not an either-or proposition. And so that's the way we think about all the decisions that we're making on a day-to-day basis. And again, and that is that you have to have a healthy community and a healthy economy, and it's a balance between the two. And again, they're not just decisions that I'm making independently or the three of us are making independently. These are decisions made in consultation with our business sector, with our hospitals, with our public health sector and professionals, with participants throughout the community, other members of the General Assembly and elected officials. I had our statewide mayor's call earlier today. We had our conference call with the hospitals yesterday, and we continue to have conversations with different sectors of the business community. And so we're going to reopen our economy gradually and safely, and that's the goal, to balance the health of the community with the health of the economy. In order to do that, we need to protect the most vulnerable Delawareans. And clearly, based on our data, based on our experience over the last 3 months, the most vulnerable Delawareans are those who are 65 and older. They're those who are in nursing homes. They have pre-existing health conditions. They are in the latter part of their lives, and so they are most vulnerable. And just last week, we talked about and committed to doing universal testing of patients in long-term care facilities, and the White House Task Force and the CDC is recommending universal testing this week, both of staff and patients, which we're committed to do, and which we have the ability to do now that we're ramping up our testing capacity, and now that we've secured over 200,000 testing kits. That's our overall objective, to expand our program to 80,000 tests per month. You do the math, and over a 12-month period of time, you're basically testing the population of the state of Delaware, and we're getting right off the mark here with 200,000 tests, as I said, that are being used in Los Angeles County, California, and other jurisdictions. In addition, you can't just have testing in order to protect the public. You also have to trace contacts that people who test positive have made over the period of time, a number of days that the public health interviewers determine, and they reach out and make those contacts, have those folks tested, self-quarantine or isolate, and then on and on. And that's how you protect from the spread of the virus and protect the public health as you reopen sectors of your economy. So we are, and Dr. Rattay is going to talk about our contact tracing program that's being developed and ready to be kicked off with the help of our Delaware our Air and Army National Guard. We'll be hiring approximately 200 Delawareans who will be contact tracers and interviewers, and we're excited about getting moving there. So as we said last week, the target date for phase one, and again, our phase one is modified and adapted to meet Delaware's needs and the advice we get from public health, as well as practical implications about what to do in a rolling reopening, where you want to gradually open different sectors of your economy, where you want to gradually provide access to beaches and parks and other public spaces. So we're going to do as much as we can, working with various sectors, as long as we can do it safely. Some of the big questions that we have over the next 2 weeks, and we are, as I said, we're meeting with the mayors today in a conference call. We'll be talking again to the beach town mayors. I know some of them are thinking through all of their enforcement options, and each beach community is a little bit different. Only 2 of our beach communities have boardwalks to speak of, Bethany Beach and Rehoboth, and so they have bigger challenges than some of the rest. And then, of course, at the statewide level, we need to answer the question about the ban on short-term rentals and out-of-state travel, the requirement for a quarantine there that'll help the towns enforce the limitations that they impose on their beaches. And so even when we reopen, everybody needs to understand that we will need to continue practicing social distancing. and appropriate personal hygiene. We still want folks to wear masks when out in public. We'll still ask people to be careful in going to essential businesses that like grocery stores and pharmacies and to the doctor's offices, as they have been able to do over the last couple months, and have been doing it carefully and keeping distant from others. And we would ask folks to continue to do that. We don't want to have a rebound in positive cases or a rebound in hospitalizations, and we certainly don't want to go backwards in terms of reinstituting restrictions that we're lightening up on at this point. And so our message from the beginning is that in order to protect our neighbors, you need to understand that your actions affect your neighbors and that your neighbors' actions affect you, and to be conscious of that as we reopen sectors while we continue to keep social distancing and appropriate hygiene. So here's the timeline of the various amendments to the state of emergency declaration, going back to March the 11th with the first confirmed positive case of COVID-19, all the way to the two most recent amendments on May the 8th. We allowed for the rolling reopening of certain sectors of the economy, certain retail stores and salons. And on May 15th, we are allowing the rolling reopening of farmers markets, which there's been quite a bit of discussion around over the last couple of months, and it's a very important sector of our food chain, as well as the markets for our homegrown produce here in the state of Delaware by Delaware's farmers. So with that, I want to turn it over to Director Shaw, who's going to go first today because we want to talk about testing first. And AJ is going to be the point person for us on that, with a team consisting of our partners and with advisory groups that would enable input from various communities across our state. AJ?
No, thank you, sir. So we'll go into this information a little more in depth, but thousands of tests have been completed there over the last 2 to 2.5 weeks. Continue to do the public awareness campaigns, providing education materials in multiple languages, distributing care kits for individuals that may be at higher risk to allow them to sanitize their area, provide them face coverings if they don't have access to it, and really trying to use our social service partners to sit down, talk to those people, measure their risk, and see what they could do to eliminate that or reduce it as much as possible. So our focus continues to be on Sussex County. We understand that there's a lot of urgency down there. As we start processing more of these tests and the numbers, we'll hopefully see some flattening there. If you looked at the new hospital admittance rates yesterday, I believe we were at 9 new admittance, which was one of our lowest numbers, which is, great news. We just hope we could keep that number, low to make sure we keep a healthy healthcare system. At the same time, we need to expand testing. We know that. We announced last week the procurement of about 200,000 tests. At the same time, we met with our healthcare partners and our community groups to kind of take the testing collaborative that Dr. Tay was leading for the last 2 months, which was primarily focused on testing symptomatic people and what tests are where. We understand the supply chain is more than stressed when it came to this, and that kind of limited us with how much testing we could do. We would meet with our hospital partners, and they would say, hey, we have enough for about the next 10 to 14 days, and kind of built in there some of their outreach activities. If they were to increase those outreach activities and they didn't get their resupply in that 10-day period, that has a ripple down effect that would have been negative for the state. So we feel that we have a backstop for that now. We need to be targeted with our testing, and that's where, as the governor mentioned, it's not myself or just Dr. Tay making the next decision where the testing is going to be. It's going to be our healthcare system. It's going to be our nonprofit groups that we've been working with. It's going to be data that we have from My Healthy Communities, other overlays that we get from partners that show the vulnerable communities down to a more micro level. At the same time that we're targeted, we want to increase the volume, and that's where I think our procurement comes in last week. Over the next 11 days, so really between now and the Sunday before Memorial Day, we're looking at 4 events to launch and refine and kind of get our process down with the new curative test to find out what the footprint of medical staff is going to be, the logistics for the footprint of the parking lot, drive-through type facility you use. At the same time we do that, our partners are going to be working at the community level, and Christiana Care and BB and Bay Health and Anacostia are still doing their community events. So as you see, we're just kind of spreading ourselves out to cast the net even wider. So over the next 11 days, we're going to be working very closely to make sure we have a plan to ramp up testing. And hopefully by maybe this time next week, we'll be able to put some numbers on what we expect to do weekly across the sector. We're also going to do a better job of, publicizing when the events are. We want people to be able to find an event that's close to them, that's convenient for them, and not inconvenience them. At the same time, knowing that we don't want to test out more, we don't want to plan out and advertise more than 4 or 5 days, because A, we don't want people to delay their testing because they're waiting for something that's close to them, and B, we want to be responsive. If Dr. Ortay throws a red flag and says, hey, this community looks like they're on a little bit of the uptick, we want to be able to get resources there and rearrange our schedule to be responsive. And also with the testing that the state will be doing is, we are moving into the asymptomatic phase now. Because we have the quantity of tests on our side, we'll be able to test those that want to be tested. With the curative test that we purchased last week, there's some technology build-outs that come with that will be provide a lot of efficiencies. People will be able to go to a website, they'll be able to answer a few questions, register, pick a time frame where they want to come in to one of the events and go through. Now that's going to be for all the testing, that's going to be for some of the high throughput ones. They will get a confirmation, and hopefully within 24 or 36 hours, they'll also get their test results with instructions what to do. If they're negative, some instructions of how to maintain social distancing. If they're positive, contact their healthcare partners. If they don't have a healthcare partner, contact these community partners to help them. Isolate yourselves. Make sure you have a location in your house where you're not putting others at risk. And that's going to speed up some of those communications with people. And hopefully, Dr. Tate at the same time is probably worried about her team getting overworked. But we know we have to get that message back to them quickly. And if they're able to contain themselves, it's less time that they'll have from spreading the disease. So again, next 11 days is going to be big as we build this up. Then our next 2 parts, and this is all what we covered Friday, is we want to make sure our frontline workers have access to testing. So we're going to work to see how we could now do public safety testing on a bigger scale. Newcastle County and New Moors did a test with the paramedics and some of the other EMS providers in Newcastle County. We want to roll something similar like that out across the state for our firefighters, public health individuals, EMS, law enforcement officers, as soon as possible. So that would be probably end of May. And at the same time, then we're going to look at the essential employees that are at risk, those that have been working in grocery stores or the essential industries that are open now. We want to make sure they have the opportunity where if we could work with employers and try and become targeted with that as well. And then the second part, or the down the road, the third bullet point on there down the road, is the employers. As people go back to work, we want to identify partners that we could help us facilitate some of these tests at their place of employment as the data dictates and as it makes sense. So, these are all things that they're not going to be decisions made just by one person. As the governor said, it's going to be our partners across the state. It's going to be public health driven, and then, make sure we bring the right partners to the table, the right test to the right person at the right time. And look, a lot of work for us to do over the next few weeks, but we are happy we had the test. We're happy we're in a position now where we're looking at testing more and having to scale that back, and look forward to providing some results in the next 7 to 10 days. So, Governor.
Thank you, AJ, and thank you for your leadership on that committee partners as we move forward. And clearly, this is one of the most important things that, one of the most important actions that we need to take moving forward to contain the virus and to identify those who are COVID positive and protect others from it. One of the things that AJ mentioned, Dr. Rattay, I just asked you to comment on it briefly, is that we have seen people that are positive, COVID-19 positive, that are not symptomatic. And I just wondered if you would comment on that. Obviously, with the expanded testing program that we're talking about and rolling out, we'll be able to identify more of those folks. To date, we've, because of the limitation in the number of tests that we've had available, we've just basically been testing asymptomatic or symptomatic folks. Could you comment on that just briefly?
Yeah, I mean, that's learning how common asymptomatic spread is with this virus has really been a game changer in many ways for how we respond to this virus. I'm really grateful now that we are able to ramp up our testing so that we can test asymptomatic people. It is really critical for us to identify as many asymptomatic people as we can to really contain the spread of this infection. So, individuals who are frontline workers, who are exposed to the public or in tight quarters, or individuals who have been exposed to positive cases are especially going to be important to make sure they have access to tests so that we can identify if they are asymptomatic.
And that kind of leads you right into contact tracing, right, in terms of, because you're interviewing and you're at least identifying somebody that may have been exposed and somebody that needs to be tested.
Yeah, absolutely. So we are extremely excited to roll out our plan today for contact tracing. I've said it many times, this pandemic is, there's so many lessons in this pandemic for all of us. Contact tracing is a basic function for public health in general. When we are dealing with infections like tuberculosis, for an example, we follow up with the contacts and test them and treat them because we have a treatment. In this situation, of course, it's not only do we not have a treatment, do we not have vaccine, but it is a widespread respiratory infection, which, so as we know, it's many more people are infected. It's more contagious, and now with the whole asymptomatic piece in it as well, that's another complicated factor, but it all again reinforces why contact tracing is so important. We know we can't, stay at home forever. We know we need to, evolve back into what's becoming our new normal. But in order to be able to do that, we have to test as many people as possible. So thank you, Director Shaw, for your leadership. And then we need to get those people isolated safely as quickly as possible, identify any of their contacts, and get those contacts quarantined. This is I think for all of us in public health across the nation, across the world, we've never ramped up contact tracing in any comparable fashion to the way we are doing it now. So we're really happy to announce a partnership with NORC, NORC, which is with the University of Chicago, to build our contact tracing program. We looked at a number of different options that other states have been engaged in. We've talked to a number of other state leaders, and we are really thrilled with both the stellar history of NORC, but also one thing that is incredibly appealing to us and we're very excited about is that they have hit the ground running a few weeks ago with the build of contact tracing in Maryland. And so many benefits of partnering with the state of Maryland on this. First of all, I think we all know that we share a large border, and even looking at the whole situation with the poultry plants, we had a lot of people crossing lines, employed in one state, living in another state, and to be able to track people across state lines is really important. So to be able to share that data is important. We also share something in common, which is we both have mature health information exchanges. We have DIN, DHIN in our state, and they have CRISP, and DIN and CRISP have worked together in the past, and so that's going to really help with the information exchange. But it also is, it's efficient. Maryland is already, invested in the build of their technology platform, and we are therefore the beneficiaries of some of that work that has already been done. So, I think we're really thrilled about this partnership. So we, as the governor said, we're looking to hire about 200 Delawareans, even though our primary vendor who's going to be hiring the contact tracers is not from Delaware. They are, the goal is for them to be hiring Delawareans, and we want to make sure that those who are interested are keeping an eye on de.gov/coronavirus, where we expect to post the positions for contact tracers on our website. In the meantime, it's really important that we do our best to ramp up contact tracing, and we're really grateful for the Delaware National Guard to be helping us. Right now we are training members of the Guard on contact tracing while we're building our own smaller scale but data system to be able to do this work, and this is going to be able to get us through at least the next 4 weeks or so. So a little bit about contact tracing. As I've mentioned, first of all, you have to identify your positive cases, right? And then you talk to them. So a case investigator will call them and talk to them and get a bit of information from them. But an important piece of that is identifying who they've been in contact with, which means who is it that in the time that they've had symptoms or the 2 days prior to their developing symptoms or prior to being tested, were they within 6 feet for more than 10 minutes. So that's how you identify their contacts, and then you track them down. Once they're tracked down, they're to self-monitor, and the contact tracers will, they'll talk them through what quarantine means and what self-monitoring means, and we'll contact them every few days. And if they develop symptoms during that time, they're to immediately contact DPH for testing and isolation guidance. If they don't develop symptoms, this is what we were talking about with asymptomatic people, we want them to be tested anyhow just to ensure that they don't have coronavirus before they leave their quarantine. Much of this system is through telephone, so about 80% of this is by telephone, but there's also another 20% or so that's actually a contact tracing field staff. So I think on the next slide we talk about this a little bit more. It's important for individuals who don't have a safe place to quarantine or isolate that they get the support that they need to be able to quarantine, but also some people need help with groceries or they don't have someone to help them with that. And also, at times it's very difficult to track down individuals. And so this field staff is going to be coordinated by Healthy Communities Delaware. It's a coordination of currently existing community health workers with community-based organizations, and really focused on our highest risk communities, our communities of greatest concern, especially our minority and low-income communities that we are already working with through Healthy Communities Delaware.
So thank you, Dr. Rattay, for that. Some really exciting developments there on the contact tracing. And so today we've talked about the criteria that we're using in the dashboard that we're looking at to make these decisions to reopen our economy. We're actually in the process of, in a rolling reopening kind of way, making arrangements where various sectors can open as we speak, the most recent of which is farmers markets under some pretty strict guidelines. They will be opening, and And again, balancing off the needs for a healthy community and the need for a healthy economy, where we will continue to work on some of those difficult decisions as it relates to opening beaches, Memorial Day weekend, and beyond, as folks from around the region and across our state flock to Delaware beaches, one of the best places to go and to visit here in our state. We want folks to do it, but do it safely, not to do it extensively soon in this month, but as we move through the summer and get more comfortable with the health of our community, to do it in a safe way, and ultimately to avoid large gatherings and maintain social distancing. So some important developments that we're commenting on again today. Our message remains the same, though, as we speak. Still a stay at home, keeping your hands washed, wear a face mask, particularly when you're in public, protect yourselves and your neighbors with social distancing. I want to take a minute to thank Pam for her signing that she's been doing for us at each of these briefings. I failed to thank her and mention her each time, but happy to do it today, and we appreciate all her good work. I know she's eager to have her daughter married, or at least have a ceremony for that, and we're working on that for her as we get healthier here in Delaware. So with that, why don't we start with the questions?
Thank you. With the contact tracing program, this is kind of a two-part question. How many of the 200 that you hope to hire here soon will be Spanish and Haitian Creole speakers? And will that program have a focus in some of these areas that we've seen more cases in, or will it kind of be spread across the state?
I don't have a specific number for you, but that is a fantastic question, and it is certainly an important priority for this program, that not only do we have contact tracers that can speak different languages, but also that culturally can relate to people with different backgrounds. So for both the workforce that's going to be on the telephone, and very importantly, the workforce that's going to be that field contact tracing team, it's going to be really important that people are from the communities in which they are working.
And how much will the contact tracing program cost, and how will it be paid for?
A lot. We don't have an exact budget for that yet. Mike Jackson is working on that, and that'll come out of the CARES Act funding from that we got from the federal government. Both the testing program and the contact tracing program will be the biggest part of the expenditures for that, as well as the assistance in unemployment, hopefully, and in small business assistance.
And to your bilingual question, that was something that was very, the National Guard really stepped up to. I believe about 10 or 15% of the National Guard members that are going to being trained this week and next week are bilingual. And so, we made sure we identified that, because it's absolutely needed in this population of, in the skill in these people.
Okay. Other questions?
Good afternoon. First question is from Sean Green at WDEL. For Dr. Rattay, roughly 150 or about 65% of the state's reported deaths from COVID-19 have come from long-term care facilities. How much of a different rate is this compared to what you would expect in a normal 2-month period? Any indications?
Yeah, that's an important question. This pandemic, this infection has been truly devastating for our long-term care residents, our most vulnerable populations in our state. I can't compare this number to our normal 2-month period on a normal year, but what I can tell you, which I think is of value, is thinking about our influenza season, which really was, December through February, kind of winding down in March, we had 11 deaths in Delaware, which, of course we were not happy with. And one of those individuals was a resident of a long-term care facility. So just the numbers and the devastation that this infection is having on residents of our long-term care facilities is unlike anything we have ever experienced before.
Tom Lehman at WBOC asks, talk about the timeline in setting up contact tracing. I know you discussed this a little bit previously, but why has it taken so long to get this system up and running?
Well, I'll start off. First of all, as we've gone through this response to COVID-19, we started, as public health always does, with a small team of contact tracers, and it seems like a long time ago, but I remember talking about that first number of cases, and the contact tracers that we employ on a regular basis there at the Division of Public Health were out tracing down contacts and doing interviews, and we were trying to get a sense as to where this was coming from. You might remember it was started in the University of Delaware community from basically a bioscience group that had traveled to New Jersey and came back with folks that were infected, and kind of went from there. And then from then on, it was like a wildfire that broke out, and we were spending all of our time trying to put out the fire and install fire breaks and all the rest of it. And at some point pretty early on, the contact tracers that we had got overwhelmed. We had what's referred to as community spread, and really put all our efforts into that. Obviously, once we got into testing and quarantining and shutting down sectors of the economy and enforcing all of that, and this is consistent with all the other states and governors in those states, as it became clear from the advice we were getting from our own public health officials, as well as from the White House Task Force and the CDC, in order to move beyond quarantine and in order to move beyond stay-at-home, shelter-in-place, we needed to stand up a extensive testing plan and contact tracing, and that was the solution that we were all looking at that was recommended. And we started talking about it, the testing part of it, for over the last kind of month and a half, I want to say, trying to identify tests, what was the appropriate protocol. We were still working with our partners, as we still are today. And then as that became clear, then figuring out how to stand up. So we're flying this brand new airplane, to use another analogy, as we're building it. And I don't know if Dr. Rattay probably sounds familiar to you and your team, having to do all these things, put out the fire, as well as planning for what we do when the fire's contained.
Yeah, I mean, I'll add, I don't know any state that has fully stood up their contact tracing program. I think Massachusetts was out in front and has been a great model for all of us. But I've been in state government, federal government, the private sector, and I'm not sure I've ever seen anything so complex and really on this scale come together this quickly. So my perspective is actually, given everything, this has been happening pretty fast.
Really fast. And you did get advice from Massachusetts, as I recall,
Absolutely.
as we were developing our own approach here in Delaware.
Tom Lehman at WBOC says Rehoboth is announcing its plans to reopen. Have you seen them, and what are your thoughts?
Yeah, we're in pretty close contact with the mayors, as I mentioned. We had them on the phone this morning, and we'll talk to them again before final decisions are made. I think what Mayor Coons really did was move towards the existing limitations that the state had imposed on the beaches. They had gone further than that and completely closed their beaches and boardwalk. And we had allowed beaches to be open for a walking, family walking with your spouse, exercising on the beach in an individual kind of way. And my understanding is that he's moving towards that. So it wasn't a decision that took us by surprise. It's certainly consistent with what we're doing. He was one of the mayors who signed the letter that I received a week or so ago about the approaches they'd like to take. So we've been working through this as a group, and it's been challenging because each town has a little bit different beach. Some have protected beaches that are easier to get into and out of. Some have more parking than others. Rehoboth and Bethany Beach have the boardwalk, so that's a complicating factor. AJ's been working hard with the towns and their enforcement people to figure out ways that we can discourage. We just want to prevent large gatherings. Well, beaches is where large gatherings take place. And in particular, the comings and goings on and off the beach, and the congregations in parking lots and in bathing houses and the rest. And so it's complicated, but we are working together with the beach communities. AJ, do you want to add anything?
The only thing I'd rather add is it's a building block perspective, because so if the beach opened now for walking and exercising, some stores opened last week for curbside pickup, anticipating as we go into phase one, other things are going to be relaxed. It's not, we just can't look at are the beach openings or the store opening. There's a ripple effect from the whole community down there, and I think we all want to move into phase one. We want to do it very cautiously. We want to make sure there's not a negative reaction because of that. So you can't put the cart before the horse. We'll use a few more analogies before today's over.
If ever the analogy about the dimmer switch fits, this is it, right? Because we really, and it's hard to do. It's hard not to just switch it right on, and because people are going to want to come back. They've been quarantined off in their homes now for a couple months, and they're eager to get outside, beautiful beaches, and in a normal year, everybody's excited about the first couple days on the beach. So this year, it'll be, that pent-up demand will be greater still.
Is the state considering, it's from Sophia Schmidt at the Delaware Public Media. Is the state considering offering any beach towns law enforcement support to help monitor beach and boardwalks as they reopen? Are there any other ways that the state can assist those towns as they start to see larger numbers of visitors?
And I don't know that there's been a whole lot of discussions around that. We do have officers that work for the Department of Natural Resources and Environmental Control for state beaches, Cape Henlopen and Delaware Seashore State Park, and obviously they're a main enforcement agency for that. I think we do need to talk to, and we'll talk to the Delaware State Police about more of the 14-day quarantine question in terms of more visibility at the borders for folks coming west to east to the beaches, and maybe north to south, south to north. But fundamentally, the compliance depends on voluntary compliance and then the enforcement of the local beach towns, and they all know their communities as well as anyone, and have a handle about how to best enforce those restrictions.
From Jeff Balk at Radio Rehoboth. Many people who have reserved short-term rentals for this summer season have contacted us as they are confused and some upset that their realtors or individual homeowners are not offering them refunds for their deposits or their payments. Some have been told that they must rebook for future visits. Some are canceling due to the current state of emergency. So in effect, not allowing those rentals. Is there any recourse for them or regulation in place for them to receive their full refund?
Well, first of all, let me go back to the last question, and the two main mechanisms that the state has to try to discourage people from coming and creating larger crowds are the 14-day quarantine. Obviously, the fact that beaches have limited openings, but also the ban on short-term rentals. It's my understanding from the Department of Justice that that's a private matter between the customer and whoever they have that contract with. with respect to deposit. I think they have I've heard from DOJ, they have a better claim if it's the full amount as opposed to just being a deposit, but that's a question better answered by the Department of Justice.
From Sean Green at WDEL. This weekend's forecast is looking to be the warmest since March. 80-degree day, since the March 13th 80-degree day that led you to close the beaches. Does the state have a plan to assist the beach towns in enforcing the exercise-only restrictions coming this weekend?
I'm praying for rain myself. I know that won't go over well with most people, but rain seems to help keep the crowds down. But no, seriously, most of the enforcement, as I said, will happen at the local town level. The state has considerable authority and responsibility for those state beaches at Delaware Seashore State Park as well as Cape Henlopen. And so we'll be working together on that and also considering our options with respect to the 14-day quarantine. And just getting the messages out for folks to stay at home this weekend and as we gradually open beaches early this summer.
From Melissa Steele at the Cape Gazette. Two of the graphs on the state site show downward trends in hospitalizations and new positive cases since the end of April. If these graphs continue to decline this week, that will hit the 14-day decline before the end of the week. If these numbers continue to decline this week, would you consider moving into phase 1 before June 1st?
No, we've tried to use the June 4th date. It is true that some of those criteria are moving in the right direction. The hospitalization one is getting better, but if you look at it, it's pretty flat. And that's been the challenge with all of our criteria. They've flattened out pretty good, but they're not really trending down except the percent positive until the little glitch in our data that's showing up today. We expect that will continue to go down based on just the sheer volume and number of tests that we're doing. People asked for and wanted some predictability, a target date for when to move into phase 1. And I think we're making an accommodation. I know we're making an accommodation there outside of the strict criteria around phase 1 by allowing certain sectors to reopen in a cautious, safe way prior to that. And we're also mindful of that as we think about what to do in a rolling reopening as we move from phase 1 to phase 2, recognizing that for some time beyond a 14-day period of time, we've had improving conditions. So it's a balancing act. Nothing's perfect. It wasn't meant to be prescriptive like that from the White House. If you look at, and I looked on the website for other states just to track what others are doing, and folks are mostly in line. And where they're not, if you look more closely, it's because, for instance, Pennsylvania shut down construction and manufacturing, and we did not. And so when they say they're doing something, they're actually going to a place that we've been all along. The same is true of Rehoboth. We talked about earlier. The state limitations were not as restrictive as what Rehoboth had imposed, and now they're coming to us. And there are other examples in the region, Maryland, New Jersey as well. So we're just trying to make smart decisions based on the criteria and the data that we see on a day-to-day basis. Try not to get too troubled by, a day or two that, something seems out of sync. Really focusing on that hospital number. And I think that's the one number that consistently allows me to feel comfortable as your governor that the approach that we're taking is a safe one and that it puts public health first, but recognizing the real difficulties, economic difficulties that we have, and there has to be some common sense there. And when you try to balance it out, where you come full circle to is protecting those most vulnerable citizens of ours. because that's what your shutdown is kind of all about ultimately, is protecting hospital capacity so you can protect those vulnerable senior citizens. And so if you're going to take more risk, calculated risk, then you need to cover that by really leading into the vulnerabilities. And in this case, it's testing all your nursing home residents, testing all your workers regularly, not just one time, in your nursing homes. We didn't have the ability to do that prior to a week ago. And so we're using the tools that we have to try to balance out really two very, very important and complementary objectives: community health as well as the health of the economy.
Two final questions. The first from Mark Eichman at WHYOI News. State Representative Collins is calling for legislation that would require the General Assembly to approve the extension of a governor's state of emergency order. Should state lawmakers have more of a say in this process?
Well, we have states of emergency where authority is invested in the executive branch. And when I say the executive branch, that includes all the cabinet secretaries and all the staffing and the rest of the executive branch, including the governor. It's not just saying to the governor has exclusive authority over all of this. That's not what it says. But you do not have that deliberative legislative process. And if I think of the decisions that have had to be made over the last 2 months, and how we've had to make them, we as a team have had to make them on a day-to-day basis, sometimes multiple very difficult decisions each day, it's hard to imagine having a committee hearing on any one of them and coming up with a recommendation to the executive branch from the legislative branch in order to address any of these. We have regular meetings and updates with legislative leaders. In fact, I am leaving this press conference here to go have one of those conference calls. And so I think that the state of emergency declaration is there for a purpose, and it does provide additional authorities to the executive branch. And I think it's incumbent upon the executive branch, the governor in this case, to communicate with duly elected members of the General Assembly, with duly elected local officials, and say, here's what we're doing. Incorporate their input into joint decision-making, but ultimately, it's the governor that has to make a decision under a situation like this. Should the legislature come in and make decisions, we expect and hope that they will, with respect to our budget, which is a really critical, probably the most important thing the legislative body does. But with respect to continuing or not a state of emergency, I think the powers as currently vested in the executive branch and the legislative branch make sense, given the difficulty of the decisions that have to be made and the timeliness with which they have to be made.
The final questions from Sean Green at WDEL. Today marks 2 months since you announced the state of emergency. What is the biggest thing you've learned about COVID-19 since March 12th? And if you had to do it all over again with the knowledge you have now, do you believe we'd be in the same place with the restrictions?
Well, first of all, I would just say in response that I've been spending all of my time focusing on what to do tomorrow than focusing on what we did yesterday in postmortem. There will be plenty of time for postmortem, and there'll be plenty of time to evaluate decisions that were made. We tried to make decisions balancing off public health science, the data that we have, the guidance of the public health professionals, with common sense and with the broader needs of the community. Most of those are economic needs for employers and for workers alike. And just thinking about reopening certain sectors in the business community. Let's just take restaurants for one. In order for a restaurant to be successful, it has to have customers. in order for customers to come back to restaurants, they have to be safe to do so, and they have to be able to come back to an establishment whose workers show up for work because they feel safe to come back to work. One of our leading restaurateurs in our conference call earlier this week, I think captured it really nicely in saying that they're all connected. And, I have to be able to bring my workers back to work, and they have to have the confidence that it's safe to come back to work. Without them, I can't open my doors. Without customers, I can't make revenue. It doesn't matter anyway. And so, we can make a decision as a team. Okay, it's safe for us under these restrictions to allow businesses to reopen. But if we haven't done that in a thoughtful way, in a gradual way, in a way that the public believes, well, these are common sense things to do, I feel comfortable, they're not going to come back. They're not going to come back, and let me give you an example. I was reading in the paper yesterday about one of the states arguably that moved too quickly in allowing people to come back to restaurants. Only 8%, their volume is only 8% of what it was before they shut them down. So 92% of the people have said, it's not safe, I'm not going back. Well, that doesn't help you. And so the answer to the question is we're going to learn a lot through this. I think one of the things that I know that we've learned, I don't have to have a big task force or a post-mortem on it, is that states and the country weren't prepared with respect to backup supplies, tests, PPE, and all the rest of it. Everybody, I think, would agree with that. This is something we've never experienced before. And so we may have, people like Dr. Rattay may have read about it and learned in books and in practice with our flu and the various diseases that you mentioned that have vaccines. But in terms of dealing with an outbreak for a virus that we've never seen before, not in our lifetime. And so a lot of very difficult decisions. I can't say enough positive things about Dr. Rattay, Dr. Walker, and their teams at Public Health for the way that they have conducted themselves confidently in a steadfast way every single day, heads down, just can-do attitude, juggling so many balls all at once, not letting any drop or very few drop, and keeping moving and smiling while they're doing it. Because when you think about it, you think about everything we're trying to do, a lot of it has to do with public confidence in our team, public confidence in the team that's on the street with our hospitals, public confidence in our hospitals. If anything that we've learned through this whole thing, I think, is that we've got an incredible team here in public health and in state government, law enforcement, and our hospital systems. And are there things that we need to focus on? Absolutely. But you talk about being able to respond. My biggest concern coming into this, right from the start, was running out of hospital treatment capacity, critical care capacity, ventilators. AJ will remember, we're barely into this, and I'm banging on him to find out how many ventilators we have. And we had plenty, and that was the good news. And there's a lot of good news. There will be a lot of good news. We're still not out of this. We still need to stay at home. We know that the actions that we've taken as Delawareans over the last 2 months and more have made a difference. We also know there's been a tremendous price to pay, particularly for those businesses who were forced to close by our executive order, by my executive orders, in order to protect public health. We also know that we can't have a rebound in the healthy economy unless we were able to do that in the first place, to close things down and get control and contain the virus and the disease from spreading in our state. And so all the actions that we were taking and all the action that we need to continue to take in terms of practicing social distancing, wearing your mask when you're in public. I tell you, one of the things that amazes me as I circulate around in my car here in Wilmington and across the state is how many people, what percentage of the people are actually wearing masks in public. And it doesn't matter where I go. It doesn't matter, what community is. I live in the city of Wilmington, so I'm mostly in neighborhoods here in the city, very diverse neighborhoods, economically, racially, ethnically. And I'll tell you, the vast majority of people are wearing masks because they understand that it can make a difference. And that tells me that our messaging and what we've been trying to do in getting to every person in our community, making sure every person that needs to be tested is tested. And that's the objective. Have we met it always? Not always, but we're getting there. And we have a plan now to ramp testing up. We have a plan to ramp up contact tracing. And we're working on plans to open up sectors of our economy. Somebody said to me on our Delaware Prosperity Partnership last night as we had a virtual board meeting, and this gentleman runs a business in Sussex County in our state. And he said he's never been more optimistic about our economic prospects here in Delaware and here in the United States of America, which was an incredible thing to say, at this juncture when we have the highest unemployment rate that we've had in probably a century or so, well, at least since the Great Depression, at a time where we are still putting out the fire of this pandemic. We don't have a vaccine or a treatment. And I also heard just about every person on that call, on that board, who agreed with what he said. And I think part of it is that optimism that we have as Americans, that optimism that we all have as Delawareans, which is really, I think, shining through all the darkness and all the negativity. And as we try to get out of this, as we work our way out of it as we are, people have made a difference in curtailing this, and people will make an incredible difference in getting us to the other side. And I for one, can't wait for that day. So thanks for joining us today, and God bless you.